I am Kavita Bahal,
And I am Kazal Jackson.
and welcome to the Live Wire. So, Kazal, what's happening in the Caribbean region of lately?
I will extend it to the world because the world is facing the most challenging time since World War II with COVID-19. And we are seeing economic inactivity, hospitals overwhelmed, people are fighting for just minimal resources. What's happening in Trinidad and Tobago, Kavita?
Well, the government of Trinidad and Tobago is one step closer to enforcing stricter laws pertaining to all citizens wearing masks. And that is due to the Public Health Bill being passed in the House of Representatives. Our Prime Minister, the Honorable Dr. Keith Rowley, has stated and has urged all citizens that masks are now part of our clothing. We cannot step out of the house without wearing our masks on. It has been claimed as well, Kazal, that the wearing of this mask can suppress the virus so that local spread will be contained. So at this point in time, as the second wave is here, Trinidad and Tobago are facing what you call a great spike in the COVID-19 virus.
Kavita, we saw that the Attorney General, Mr. Faris Alwari, as well as the Minister of Health, Terence Zial Singh, when they made the announcement on the 31st of August. We have to also understand that these leaders are under tremendous pressure. And it is time for us to stop the political games and come together as a people. They need our support just as much as we need their guidance. So let us support them. Let us rally for them. However, the Attorney General stated masks ought to be used on vessels, vehicles, and in public spaces. To a certain extent, we have to agree because the masks are needed. It is international that masks are needed. One would stand to question now when he said that the PH drivers, he cannot differentiate between PH drivers and private-owned cars. Then, Kavita, I can ask, can you differentiate between bandits and you, or bandits and me? Because we are all wearing masks. So does that mean to say that because we are wearing masks and may look like a bandit, we should not wear masks? In that same vein, wearing of the mask, yes, it is necessary in public spaces, but when you share a vehicle with your immediate family, your husband, wife, and children that are sharing a common household as well, a common space, is it really necessary for them to wear masks in their private vehicle? I'm not talking about a public vehicle, in their private vehicle. And does the law make allowances for criminal behavior because PH is still illegal in Trinidad and Tobago? So these are some of the questions that I think that probably needed a little more consideration.
Clarification.
Yes, but it's always easy for us to point fingers when we are not on that side.
And that's the thing, Kazal, we are all in uncharted waters at this point in time. It begs me to question, a child who is 9 years old and isn't wearing a mask should be taken to child court.
Well, the laws simply state that children under the age of 8 cannot commit, or do not have the propensity to commit a crime, right? However, 8 years and over. I would have asked the minister to consider that there's a lot of anxiety that is taking place in a society, and much more so even for children at these times that continue to evolve and changes is so rapid.
Yes.
Now, their whole world has changed.
Yes.
Now, to hear that, yes, we understand that COVID, we are fighting a crisis, an unprecedented challenge that is forcing all of us to change the way we do things.
Yes.
We have to adapt to new changes and we must adopt new measures. That I do understand. But these children, to put such strain on them and such responsibility on them, in addition to the challenges that we are all facing right now, may have been a very harsh approach, I think. But yet still again, I do understand the minister's position because he's begging us and he's urging us, please wear the mask, wear the mask, wear the mask. And yet still there are some persons not wearing the mask. So maybe it is their way of putting a stricter measure in place to force people to do the right thing.
But then, there's a point that I would like to bring. There are some children who have asthma, some children who have anxiety. There are also the elderly. And now, whilst I understand that the mask will assist in limiting the spread of the virus, we also have to consider those who have a lot of health issues as well.
Well, Kavita, the minister did make mention for that as well. Because when Mr. Alwari talked about Regulation 6 and 7, and he said there's limitations such as people with mental disability and physical disability as well as distress, meaning the claustrophobics like myself. I am claustrophobic, so wearing a mask, sometimes I feel as though I am going to die, literally. I feel faintish, I feel weak, I feel dizzy. Now, I'm not in a mental or physical category, but in a severe distress category. So he did make limitations to that regulation in terms of persons having such disability or inability to wear masks. And when he said wear masks, he was talking about covering the nose, mouth, and chin. Now, this is my thing on this. Police officers are not medical professionals, and how are they going to exercise their duty and understanding the difference between these varying groups? How are they to differentiate when a mask is a new norm, and we have to understand the nuances of this norm? It is new. So yes, we as humans, we may tend to forget. We may tend to be neglectful at times. Sometimes you may just remove your mask to have a drink and forget to put it back on. So it's not to say that we are wearing our mask in a different fashion underneath our chin or on top of our head, but because of the fact that it is so new to us, forcefully new, that some persons may at times forget to put back that mask on. What about those persons who may have just take a tablet as well, remove the mask to take their medication and forget to put back on that mask? So again, we have to really urge the population as much as possible and understand that we all are going through this together. These are challenging times. We have never seen anything like this before. And to be our brother's keeper is essential. We are not politicizing or casting blame upon any government or any leader as such, but we are asking to have a unified voice in our fight against COVID-19.
Well, I am definitely an advocate for wearing masks. I think that I know that I support our government because they are doing a fantastic job so far. And I mean, we all have to support them as well. It's difficult, especially when you're in that hot seat. So I would like to urge our citizens, please wear your masks.
If and where possible.
Because this is the only way for us to actually assist in keeping this virus on a lock.
And we are with Dr. Carol Bagan Khan. And we are really humble in your presence, Dr. Khan, because normally we are either with a lawyer or a doctor. And today we have the expertise of both worlds combining together. For that accomplishment, now let me congratulate you.
Dr. Khan, the independent senator, Dr. Dayal Singh, stated that now may be too late in terms of placing all this effect into mask wearing. But at the end of the day, it is claimed that wearing masks will suppress this virus from spreading. What are your views on that particular statement?
Well, I'm inclined to agree with Dr. Dayal, Bama Dayal, saying that perhaps it is a little late. It's probably too late. I think the virus is out and multiplying rapidly in the community. And I don't think a lot is going to be accomplished with mask wearing at this stage. But it may make some people feel safer. If you're ill, it helps to prevent you from giving it to somebody else.
What do you think about the Minister of Health statement when he said that the former diagnostic test that they were using is 25 to 50% false negative, and the new test that they're going to use, the antigen testing, have a higher percentage rate of success? What do you think about that? So then, is it that the reflection of statistics of our data in terms of COVID-related patients may not be correct?
I believe so. It may not be, and there's probably a 25% chance that we have an error, false positives.
Right.
Yeah.
And he's saying 25 to 50% in his last statement come August the 31st. Now they're ordering over 100,000 new tests with the antigen tests. Should that have been ordered much earlier, prior to election? Because if that was done prior to election, we would have gotten probably a better reflection of the statistics per capita of how many persons have contracted COVID-19.
Yes, I totally agree with you. Prior to elections, if that rapid testing had been done, we would definitely have been at a better stage of assessing the infections that were present throughout the community. And I think the political parties would have been more cautious in the way they did their campaigning, especially with their supporters, insisting they wear masks, insisting that they practice social distancing. all that went to do it during the campaigning. Had that been brought forward, more testing been done, I'm sure they would have been a lot more cautious.
Yes, you bring a good point, because with the political campaigning, I think people were looking for some form of escapism. Because
Yes.
you're hooked up, you're feeling a bit constrained because of the circumstances. So they use that as a jam and wine, because we saw some of those campaigns, what it looked like.
Yeah, need to get out at least once a day and take a walk and experience the open air, the fresh air, the breeze, nature. Because I think everybody's missing out on that.
Yeah.
That whole new world, that world of nature that we used to take for granted, suddenly seems to have evaporated and disappeared. It's almost as if we're all living in a cubicle. And people are feeling that way, they're frustrated.
And then with the new Regulation 6 that Mr. Alwari made the announcement, I do understand that the government is in a hot seat. I mean, this is difficult times. This is unprecedented time, but we are not prepared for. They are trying. I know they are under a lot of attack as well, because we have a lot of politicizing. So I say to everyone, let's end the political games. However, to say to a child over the age of 8 to have a legal responsibility, Dr. Khan, I think it is too much. I think it is too much, because we have to remember that these children, they are experiencing some psychological trauma. Parents as well are experiencing psychological trauma. The world at large is a global pandemic. Now, to add more strain upon this pandemic, upon these young, susceptible minds, it's too much of a harsh reality for them to carry. Do you agree with me?
I totally agree. To impose upon a child who probably is still struggling to understand what this pandemic is all about, and then to tell them, you have to be careful, because if you go outside without your mask, you could have to pay $1,000. And the child probably doesn't have that, and his parents probably don't have that.
Well, I certainly don't have that. So I'm saying now that even with the $1,000, that it is so high, because we are in an economic crisis.
Yeah.
This is a suppressed economic time. Now to even say, it's not $100 you're saying, to say $1,000, for not wearing, and sometimes it may just be forgetfulness.
Just
because
forgetting.
it's a new normal. You take a tablet, you forget to put back on that mask. You drink some water, you may forget to put back on that mask. And you may just be the unlucky person to get charged with that fixed penalty. Adding now to an additional stress that you already is ongoing stress. It's a lot of stress. I tell people there are two types of stress. There's distress and new stress. Let's not add to distress.
But our Prime Minister did say, your mask now is part of your clothing. But then again, we understand this. But looking from a child's perspective, which is what I want to touch on, you're already traumatized because you are taken out of school. You are placed in a home environment, so you're in a prison. Home isn't where you feel as though you could free up anymore, because right through your parents are listening to Facebook, the news, everything is about death and COVID. Death and COVID, death and COVID. Then you have these children who are germophobic. Oh my gosh, mommy, I'll die. I'm touching this, I'm gonna die. Or, even my son, sometimes he does that. And it's scary. And for me now to say, okay, son, you have to go now wear this mask when we go out. All he says, mommy, I prefer that I stay home. Because of the fact that you are afraid now of the outside world, you are afraid of the unknown.
And this is what is probably starting to happen. The children, who should be encouraged to interact with one another and play, because that's how they learn, through play, will not have that exposure. What are we developing? Some kind of autism in these children? What's going to happen?
Yes.
They will not understand how to play and how to interact.
Kavita, I would not say that the home is a prison, because I don't have a cell. I tend to see the home as a safe haven. I tend to see the home as a place where when you come in that space, you feel as though that you can be your complete self.
Our home may be a safe haven. Our home, how we bring up our children or what we do. But other homes are not our home. You see, a lot of children, they undergo stress. They have abuse. You have rape. You have incest. You have so many other factors coming into play. So looking at our home alone is selfish. We look at holistically when we look at children. What exactly is happening? And my heart bleeds. Sometimes I look at my children and they are playing comfortably, they are home. Then I study now my children because I'm a mother to many. I'm also an educator. And I wonder, what are my kids doing? Because I refer to them as my kids too. And students come to teachers first, especially when they have problems. And I say, okay, we are not within our safe haven, but nobody knows what is happening to them, what horrors they are facing. So we have to look at it on two sides of the coin. The safe haven part, and then you have the horrors, which is the reality of what society is projecting. It's just that we don't know because our eyelids are covered.
No, I'm going with a generalization of what the home is supposed to be. When we give a sociological definition of a home, I'm not talking about a house, but I'm talking about a home. So in the absence of COVID, these ills were always with us.
Yes.
I'm sad to say these are ills that one would have to face. However, now with these children, inside of these homes, looking now for mommy and daddy in private spaces. Now, the law cannot be seen in isolation, I would think. The law should be seen holistically. So now, your vehicle is your private vehicle.
Correct.
Now, when did that private space become a public space within the confines of that private vehicle with your immediate family? When did that space move away from a private space to a public space in which one can be charged?
Yeah, and that to me it is kind of mind-boggling, because I wonder that doesn't really go against the Constitution, which gives the right to family and to freedom of movement and to wear what you have to wear. Why must you insist that a family, a unit that normally lives together all the time, should have to get into a vehicle and then wear masks simply because they're in a vehicle?
So at home too, we should wear masks then.
Yeah,
we should mask up at home as well.
It's a paradigm, it's a paradox. It doesn't make sense.
And I think that as media personnel, we have a responsibility as well to promote positive media, to sometimes divert the attention away from the constant negative that is not healthy for children and even for adults to constantly be bombarded with. But look at the positive, because we are resilient people. We adapt. And I tell people, look at the sky. Now, even when it is dark, stars shine. Now, let us now look for new opportunities. Let us now look at a new focus. Let us now look for new ways of doing things. Let us now be innovative and not so much this level of dependency and hegemonic control that we are still waiting for World Health Organization, that we are still waiting for America to say this should be done, that we are still waiting for other first world countries. We have some of the best right here in our Caribbean region. Let us now empower individuals to be innovative. Let us now empower our children to come up with new ideas, because we cannot ignore any.
But Crystal, to add to that, empowerment, we need people to come together, because in unity, that's where we'll find strength. And I think that is what we are lacking at this point in time. COVID has dampened many spirits. And we need to find that crack, that light within, and look through there as some sort of positivity within all this dampness and negativity.
You know what I would like to see? I would like to see a political utopia. I would like to see the red and the yellow and the green forming the rainbow of Trinidad and Tobago. I would like to see a collective thought. I would like to see a collective opinion in terms of how do we move together with each other. And then I shall say that we have done it. Because sometimes disaster comes to teach us a lesson. And out of every mess, we also have a message. Maybe it is time for us to stop this bipartisan politics that we display in Trinidad and Tobago and excel beyond. Let us teach the Caribbean, other countries, something new.
And because funny enough with that message, you're saying the yellow and the red and the white and so on. It reminds me of wires, And I'd like to draw again, live wire. When the current runs through, you join together and exactly, you light up. And that is what we need at this point in time.
And we are with Mr. Samson Acevedo, Clinical Director here at Peru Dialysis Center. Ms. Asivera, we do understand some of the limitation with the mask wearing. And how about your patients that are suffering from some level of renal issues in terms of the oxygen? Well, they are inhaling carbon dioxide, which we're supposed to exhale, and then restricted and limited oxygen trying to seep through these masks. Are you having difficulty with your patients here at Perico?
At this point in time, no patients are complaining about any respiratory distress or what have you. I must say that some of them who cannot wear masks will wear a face shield, and that allows them to fend off everything that might be coming towards them. The nurses wear their mask, and the patients wear their face shield. So it kind of is a buffer for people who cannot deal with or who is suffering from respiratory sicknesses like COPD, asthma, and all these stuff. The face shield is a good tool to help people who can't always wear a face mask at times.
I know you're also a family man yourself.
Yes.
Now, how are you coping with the new legislation that says that children above the age of 8 have to wear face masks?
For me, if I'm taking my children out and we know there is COVID out there and I am wearing a mask, I will probably want them to have some level of protection also. So I will definitely, if they are above age and there's a mask that is available for them, I will have them wear it, because when they get it, we all get it too. Because if I'm walking outside and I have one and they don't have one, it's kind of oxymoron.
Quite true. But do you think that the legislation is too strict? Because it is mandatory for children above the age of 8 that they have to wear these masks, unless there are certain limitations, of course. But do you think that this is too rigid for these children?
Every law that is made or what have you, it will have its flaws or what have you. But let us look at the major picture. We are facing a pandemic right now. We have situations where people are dying. I think the death toll right now is at 27. We still have 1,000 and something people still in facilities. 600 and something people have already been discharged. And let me tell you something. These laws are in place, yes, to give awareness to people. Not everybody going to follow the law. The law says drive at 60, we drive at 100 sometimes. But at least the law is in place to make people aware. Try to wear your mask when you can. When you go out in public, try to wear your mask when you can. Because if I walk around the street walking out a mask and we all doing that, these numbers are already going to go up. We have the healthcare system that could easily be stressed on with limited amount of doctors, limited amount of nurses.
The can be overwhelmed.
And we don't have a lot of dialysis nurses too in this country to be able to supply. So I know it have a lot of restrictions, but let's look at the bigger picture. Over 1,000 people, we don't know how much more is infected, how many people are walking around just like you and I and have it in us, but we are asymptomatic to the symptoms that we are commonly known for COVID-19 patients to have. So we have to always, even though the law is strict with regards to, and may seem like it have some flaws, I will tell us, remember the whole purpose of it to help reduce.
So you're talking about from a collective approach. Let's look at the collective good of these laws and what they are trying to implement, yes?
Correct.
You know, Doc, when you're looking at the fact, right, that there's a concept that you should believe that everyone is positive.
Yes.
Maybe each individual will take that advantage of protecting themselves some way or the other.
Yes.
However, when wearing these masks, the components of the mask we are breathing in, what are the limitations or what are the difficulties that a child from the age of, let's say, 2 to 10 can face wearing these face masks on?
So you are saying someone who is 2 years, they are not really mandatory to wear masks, so I guess that takes care of that part of your question. But the ones that cannot, we try to make our best. School is closed now, everybody is in the house, you go out if you need to. We know this thing is real out here. You bring this thing home, nobody's worrying about a face mask after.
But how would it affect this 8-year-old, 10-year-old or 11-year-old child with wearing this mask? Because you are breathing in these components continuously. How will it affect them? If not now, but later on.
With regards to that, I can't really give you a scientific data on it or what have you, but just from the common sense of using a face mask, going to deal with something or going to take out a trash bag or something, I will try to cough my nose, wear something to kill the smell down or what have you, right? If people talk, certain particles comes out of their mouth, certain things come, we notice that certain pathogens in this COVID-19 can stay in the atmosphere for a couple of hours before it happened. So if we have to go out and we have to, nobody say wear the mask in the house, but if you have to go out, stay protected, because when you bring this home, you have people who have little children home, babies and things, you bring that home, you're going to wipe out the entire family.
If our children from age 8 and above wear the face shield instead of a mask, would they still be convicted by law?
No, they would not.
Would
so
not.
he said that any material that covers the nose, mouth, as well as chin, you can say face shield, face mask, as well as coverings.
Good.
So he made allowances for different type of coverings. Yes, he did.
Yes, because on social media, they have so many questions. I know you would like to make the citizens know, for those who are asking, that you can't use the face shield
And
and
then
the mask.
still there are some people that is still politicizing COVID-19, which we should not do. There are still people who are disgruntled from the elections and using this as a means in which to attack the government.
Yeah, they're weaponizing it.
Yeah,
And that's
we should
not nice.
We should not, because now is a time for us to have a collective conscience in that let's merge together. Let's come together. Let's forget about partisan politics, USC, PNM, ILP.
And as we know it, this virus does not discriminate based on race, class, or anything, Kizal. And in our last discussion, we stated the same thing. At the end of the day, when you unify, you become stronger.
Yeah, but you know something, Kavita, people looking on right here, because we divide based on race as well. They look at me, they say PNM. They look at you, they say UNC. They look at you, they say I don't know, right? So, looking at this, let us not look through political lens. Let us not look through the lens of the yellow, the lens of the red, or the lens of the green. Let us look through the lens of nationality and come together and really put a collective fight. Assist with the ministers, assist with the prime minister,
Yes.
assist with the CMO. Let us assist them so that we can fight together. Let us be a unified army in this collective fight against COVID-19.
And I agree with you, because we must not cast blame. What we need to do is we need to work together, unified.
And let me say something too. Yes, COVID-19 seems to be going rampant and it seems to be going out of control here, and a lot of people are being diagnosed and what have you. And everybody is looking to pass blame on the government and what have you. Remember, this is a world pandemic. Trinidad is not facing this alone.
I don't know.
America is not facing it, Russia and so forth, and all the other CARICOM region. We are all fighting this. And let us not try to depend and say what the government going to do about it, what the government...
What can I do?
What can I do? And like JFK once said, let us not ask what our country can do for us. Instead, let's ask what we can do for our country.